Any possible doubts, whether or not well-founded, about the safety of the vaccine cannot be allowed to exist in view of the need to assure that the vaccine will continue to be used to the maximum extent consistent with the nation's public health objectives. Wow, this is incredible. This is from Robert Malone's Twitter, and I just confirmed it. We're going to dive in here. This is Dr. Malone, MD. He was instrumental in the development of the mRNA technology. His bio reads, inventor of mRNA vaccines and RNA as a drug. Look at this. Once again, please remember, it is written into federal U.S. law that the government shall lie about vaccine safety and efficacy. We're going to come back to this image here. This is the key excerpt from this document here. This is the Federal Register from 1984, June the 1st, 1984, and it's buried at the bottom of this document. The Federal Register is the official journal of the federal government of the United States. Now here's the key excerpt. Any possible doubts, whether or not well-founded, about the safety of the vaccine cannot be allowed to exist in view of the need to assure that the vaccine will continue to be used to the maximum extent consistent with the nation's public health objectives. So I'm going to put a link to this document in the description. This is on page 255. Any possible doubts, whether or not well-founded, about the safety of the vaccine cannot be allowed to exist in view of the need to assure that the vaccine will continue to be used to the maximum extent consistent with the nation's public health objectives. Wow. So this is straight from volume 49, number 107, Friday, June the 1st, 1984, Rules and Regulations. I'll leave a link in the description. Page 255. Any possible doubts, whether or not well-founded, about the safety of the vaccine cannot be allowed to exist because they want to keep using the vaccine to the maximum extent. That's the public health objective. Accordingly, because of the importance of the vaccine and of maintaining public confidence in the immunization program that depends on it, good cause exists to issue these amendments as a final rule effective immediately. The fact that the amendment relieves a restriction also justifies making the rule effective immediately. So effective immediately, any possible doubts, even if well-founded, about the safety of the vaccine cannot be allowed to exist because they want to push the vaccine. Now, this was back mostly concerning the polio vaccine, but the question is, does this same rule apply? It sure seems like it. So let's do a deep dive here, give us some context into what they're talking about. This is the Department of Health and Human Services, Food and Drug Administration. Additional standards for viral vaccines, polio vaccine, live, oral. So it's very interesting what they're doing here. This is concerning the oral poliovirus vaccine, also known as the Salk vaccine. So one thing that jumped out at me is they had this thing about 5 lots. And they're saying, if I'm reading this right, that they don't all have to be effective or safe. So here's a key section. FDA is also amending 630.11 by removing the provision that the 5 lots of oral poliovirus vaccine used in the required clinical trials each show satisfactory results in all prescribed tests. So they're removing requirements for satisfactory results. This change is prompted by questions concerning whether all lots of polio vaccine used in clinical trials in 61 and 62 as a basis for the currently licensed oral poliovirus vaccine showed satisfactory results in several tests. In tort litigation involving the federal government and private parties, questions have been raised concerning whether some of the lots of vaccine used in 61 and 62 clinical trials met the test standard for neurovirulence prescribed in section 630.16b1. The purpose of the tests, which is performed in monkeys, is to assure that the live virus used in the oral poliovirus vaccine is properly attenuated, non-virulent. FDA has reviewed the data and has concluded that, although there may be a question as to whether the results of all the neurovirulence tests met the standard in the regulations, there is no doubt that the oral poliovirus vaccine used in the clinical trials involving 195,000 subjects was of acceptably low neurovirulence. Nevertheless, for the oral poliovirus vaccine used in the initial clinical trials, the results of the test for monkey neurovirulence are open to interpretation and might be considered not to meet the specific terms of 630.16b1. So what did the FDA do? It says right here, the FDA has concluded that it is in the best interest of the public health to amend 630.11 to eliminate the unnecessary requirement that the vaccine used in clinical trials show satisfactory results in all tests applicable to lots used in clinical trials, and thus avert any possible loss of confidence in the polio immunization program. So let's just take away testing requirements. Let's not have high or even decent standards, because that might have a possible loss of confidence in the immunization program. So they're changing their requirements to push the vaccine. And this was back in 1984. The agency emphasizes that there is no basis for concern about the actual safety of oral poliovirus vaccine. We don't think that it requires a regulatory impact analysis. We also don't think that this is a major rule, which probably means it would have had more scrutiny. But they want to do it right away. And look at the reason why. FDA believes that delaying the change made by the amendment to 630.11 would be contrary to the public interest. As discussed above, questions have been raised in litigation about whether the vaccine used in the clinical trials conducted in 1962 for the approval of the sole license for oral poliovirus vaccine met all of the technical requirements in 630.11. FDA believes it is in the interest of public health to make the amendment effective as soon as possible to make certain that questions concerning whether the vaccine lots used in the original clinical trials technically conformed with the requirements of the additional standards in 21 CFR 630.10 to 630.17 do not cast doubt on the safety of the vaccine and on the continued viability of the polio immunization program. Wow. We don't want it to cast any doubt on the safety of the vaccine, so we're going to change the requirements that were already codified. As noted above, the oral poliovirus vaccine is the vaccine of choice in the United States. As a result of the use of the vaccine, cases of blah, 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 blah. So we're just going to change the safety standards so people can't challenge us in court. And that's what takes us to the key section here, which we already read, but let's read it again. In view of the technical nature of any possible deficiencies in the lots, FDA does not believe that action to revoke the license under 601.5 is warranted. However, although the continued availability of the vaccine may not be in immediate jeopardy, any possible doubts, whether or not well-founded, about the safety of the vaccine cannot be allowed to exist in view of the need to assure that the vaccine will continue to be used to the maximum extent consistent with the nation's public health objectives. This is so telling. So even well-founded doubts about the safety of the vaccine cannot be allowed to exist because they want to keep using the vaccine to the maximum extent because that's their public health objective. Because of the importance of the vaccine and of maintaining public confidence in the immunization program that depends on it, good cause exists to issue these amendments as a final rule, effective immediately. A final rule. So let's end where we began Dr. Malone's tweet. The noble lie. In politics, a noble lie is a myth or untruth, often, but not invariably, of a religious nature, knowingly propagated by an elite to maintain social harmony or to advance an agenda. The noble lie is a concept originated by Plato as described in the Republic. And you can see this is the paragraph that we just read. So here are some examples of the noble lie. Herd immunity is required to enable economic and social recovery. Vaccines are the only route to achieving herd immunity. The COVID-19 vaccines are perfectly safe. The COVID-19 vaccines provide protective, durable immunity. And finally, natural immunity is short-lived, narrow, and ineffective. So I think this is bombshell. This is an official United States federal policy. Dr. Malone knows the ins and the outs of the business. He says, once again, please remember, it is written into federal U.S. law that the government shall lie about vaccine safety and efficacy. Let that sink in.